Hello all, and welcome to today's presentation on pain and electrophysical agents related to our case study. What is pain? Pain is a broad concept with everyone having their own definition of what they believe pain is. According to research, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Many of our patients' pain as practitioners will be physical and presented through a form of injury or chronic illness. It's important we understand that pain will vary between patients and other factors can impact the physical pain they feel. So the biophysical social model, pain is not only physical, hence not only being caused by physical forces acting on the body. This is known as the biophysical social model. It is a concept that pain can be caused or enhanced by individuals' psychological or social factors. The idea was originally created by two surgeons, John Loza and Gordon Waddell, in 1982 and 1984, where they observed their treatments for lower back pain were ineffective as their patients' pain was altered by other factors. The relationship between biological, social, and psychological factors can enhance or reduce a patient's pain level. So peripheral and central driving pain, different types of injuries can be presented from either the peripheral nervous system or the central nervous system, sometimes both. Peripheral pain is any pain caused originating from the peripheral nervous system, often being nerve damage leading to discomfort and weakness. Central pain is any pain caused originating from the central nervous system. So these pain and injuries can occur due to injury in the spinal cord or brain being injured. And just for note, nociceptive pain is often caused from an injury, whereas neuropathic is from a disease. As we can see to the right, there's a couple of examples. Use of electrophysical agents. EPAs are a wide range of energy sources. These energy sources can be utilized in various ways to have a therapeutical and psychological benefits for pain. According to Watson and Nussbaumer, electrophysical agents have long established place in patient care, with the first book wrote about EPA using dated back to 1948. Commonly used EPA therapies include thermal application, electromagnetic stimulus, and electric stimulus. Common examples of these are TENS, therapeutical ultrasound, interferential therapy, and heat application. So moving on to our case study, we have the subjective examination to the right, some key points. Our patient is a female, 67 years of age, has had knee pain for the last 15 years, which has increasingly got worse over the past 6 months. Aggravating factors are inclined stairs, gardening, sitting with knee bent. The medical history, high cholesterol, previous bowel cancer, depression. Lives at home with a flat house, no stairs with her partner. Then we have her hobbies and motivations, which both are to do with gardening and dancing, playing with her grandchildren. So objective examination, the key points to take away here, we can see there is the swelling of the right knee, which can be a contraindication for certain EPAs. The right knee cannot hold the body by itself, which displays weakness. And when doing a single squat, only 1/4 of the squat motion can be completed by the right leg. So this shows a lack of knee flexion and lack of mobility. So the use of EPA for Edna Gray obviously will be to reduce pain. After examination, there are certain modalities of EPA that are suitable. However, there are two modalities that cannot be used as they are a contraindication. So these are thermal application and ultrasound, as there is swelling on the right knee, and these could cause further damage to Edna. For this reason, we will be using interferential therapy to aid pain relief, as well as reintroducing TENS, which is previously used to help aid that pain relief. So here we have the contraindications. It just shows here for the swelling. So this is why we cannot use heat or ultrasound. So before using TENS and interferential therapy, we must check that the area of skin has sensory reaction. So you must gain consent to start, and before applying any electrical stimulation, you must do a sensory test. Here you just grab a sharp and a blunt object. You ask the patient to close their eyes and apply it to the skin. Make sure they can tell the difference between each object. Once this is passed and your patient understands what is happening, you can then move on to the therapies. So interferential therapy, this is the use of electrical currents to aid pain relief and increase muscle stimulation. It also helps with swelling reduction and increases blood flow. It mostly stimulates peripheral nerves, but as said, can stimulate areas of muscle. Just down here, this is how I would set up the interferential machine, which you can read yourselves, and we'll move on to TENS. So here we have TENS, which is a small affordable machine that also uses electrical currents, which it delivers to the skin via conducting electrodes to the nerves, which helps with pain reduction. It's more beneficial for acute pain, but it can be used for chronic pain, which we will use, as she said she wanted to. It reduces pain by triggering and modulation of complex neurohormonal, neuropsychological, and cognitive systems involving the peripheral nervous system and central nervous system. As she has already used TENS, we will use it again and reevaluate the settings. As it is a large area, I would recommend using 4 pads, and down here we can see how I would set it up and show her how to use it. And then we have the references, which you can just read yourselves, and that will wrap up today's presentation. Thank you.